This is the DFW Child Baby event, and we are here with Damita Williams. Damita, you are the Chief Nursing Officer for Medical City Plano, and that's, of course, our reigning best place to have a baby in Collin County, as voted by our readers. So thank you so much for being with us today.
Thank you for having me.
So new moms have so much to think about as they're going through their pregnancy. Nobody really expected a pandemic to be one of them. Talk to us a little bit about how the pandemic has impacted the pregnancy experience and delivery.
Well, it is a shame that the pandemic happened this year, but it really shouldn't impact the mother and her significant other's experience with having a baby. That's a very important part of their lives. And so we at Medical City Healthcare have tried very hard to make it the best experience that they could possibly have. We've been committed to assuring that they aren't impacted by this.
What are some of the protocols that you have in place to make sure that those things don't impact mom and dad?
Well, we've done several things to reassure all of our guests and visitors, as well as those moms having new babies. We start off with our facilities and ensuring that they are clean and pristine and that we have the highest standards of cleanliness around so that people don't have to worry about infections in our hospitals. We also make sure that we have protocols in place around anyone that enters the building, whether that's our staff, our physicians, our visitors, or for our patients. We have universal masking, so anyone that enters the building wears a mask at all times. We also make sure that we have limited our visitors in alignment with national protocols and recommendations for restricting visitors during this time.
And it's not just restricting visitors after baby is born. There's a limitation on the folks who can be in with the moms during labor.
That's correct. And what we've found is actually has enhanced the experience for the mom and their significant other. We've received very positive feedback about the intimacy of that delivery. We are our Leapfrog A hospital here, and that is the highest quality and safety rating that a healthcare organization can have. And so the most important thing is that that baby is born safely and that mom remains healthy during that delivery experience. After that, we make sure that the mother and significant other are able to tailor that experience and individualize that. Everybody has in mind that ultimate birth experience, and we make sure that they are able to select the things that they'd like to have as a part of that experience to build those memories for themselves.
Yeah, it's nice that the pandemic hasn't changed everything. And one thing that I would assume is the same is how important your labor and delivery nurses, how important your postpartum nurses to that whole experience.
Every mom that has a baby tells the story of that relationship they have with that labor and delivery nurse and that special relationship they have in the hospital. And our nurses have a great deal of tenure. We're very proud of that and the time that they are able to make that compassionate, connected care experience with their patients.
What would you say to moms who are concerned about the virus, both while they're pregnant and then for their baby after delivery?
I think the biggest thing is to remember that to follow the guidelines that are in place, and that's what we do as a healthcare organization. We always follow the evidence-based guidelines that are available to us, and right now the most important thing that they can do and their loved ones is hand washing, the basics of soap and water for hand washing, wearing a mask. We really have in the state of Texas in particular flattened the curve by following these guidelines and protocols and our social distancing guidelines that we have. And that has worked for us, and it's demonstrating that in our state, and we're having good success with that. And just like most new parents, you don't want to have your newborn around large crowds of people and a lot of people touching your newborn baby. You never did that, regardless of COVID. So to keep those things in mind that you always did are still a very good idea.
What are some things that expectant moms should be looking for in a hospital during the pandemic and anytime?
Well, an expectant mom should always be looking for a hospital that has the trained staff that is able to care for her and her unborn baby should there be any complications. So the medical professionals, physicians, nurses, and trained medical staff that could care for her and her unborn baby, regardless of what happens. So a high level of neonatal care, which we have available in our facilities. And then you want to, with respect to COVID, you want to make sure that the hospital has protocols that they're following that line up with the Center for Disease Control or the CDC guidelines.
Really important information. Damita Williams of Medical City Plano, thank you so much for being with us. We appreciate your support and all of Medical City Healthcare support for DFW Child's Baby Event.
Thank you.